Hi, everyone. My name is Lori Peak, and I am the Principal Investigator of the National Science Foundation-supported CONVERGE initiative, which is headquartered here at the Natural Hazard Center at the University of Colorado Boulder. It is my great pleasure to welcome you to the CONVERGE webinar series. Today, during this brief 30-minute webinar, we are going to share the first CONVERGE training module, which focuses on the topic of social vulnerability and disasters. We are so grateful that you have joined us today. Before we launch into the demonstration, we wanted to note that this webinar is being recorded. The captioned recording and slides will be posted on the CONVERGE website at converge.colorado.edu. Should you have any questions or comments during the webinar, please use the Q&A box or the chat box. If we are unable to respond during this brief webinar, we will provide and post written responses on the CONVERGE webinar webpage for this session. We are eager to receive your questions, comments, and suggestions as we move forward with the broader CONVERGE initiative, as well as with sharing this particular module. During this 30-minute webinar, you are going to learn more about the CONVERGE Social Vulnerability and Disasters Training Module. First, though, a few words about CONVERGE and this training module series. CONVERGE is dedicated to advancing ethical, coordinated, and scientifically rigorous hazards and disaster research through linking together various disciplinary research networks in engineering, the social sciences, and interdisciplinary spaces. One of the major tasks of the CONVERGE project is to accelerate the training of students, emerging researchers, and others new to the hazards and disaster research field. To that end, our team here at the Natural Hazard Center is creating a series of free online training modules that are specifically designed for hazards and disaster researchers. Today, we will focus on social vulnerability and disasters. But soon, we will be releasing a number of other modules focused on a range of topics, including disaster mental health research, cultural competence in hazards and disaster research, and conducting emotionally challenging research. We are also currently working on modules related to research ethics, social science, and interdisciplinary methods, and best practices for publishing and ethically sharing data and findings. For all of those of you out there who have completed the CITI training to prepare to conduct human subjects research, please think of what we are doing here as something similar, but specific to the hazards and disaster field. Just as you earn a CITI certification to conduct human subjects research, it is our plan to continue to offer individual certificates for each of these modules, while also building toward a credentialing system for hazards and disaster researchers to help ensure a minimum competence in the field and to ultimately democratize access to information through providing free resources. You will hear today from Rachel Adams, who is a postdoctoral research associate at the Natural Hazard Center and with the CONVERGE initiative, as well as from Candace Evans, who is a graduate research assistant at the center and for CONVERGE. Rachel and Candace have worked for several months on writing and developing this module, and they will be providing an overview and interactive demonstration of the training module. On a personal note, I want to say what a pleasure it has been to watch Candace and Rachel work and to work alongside them. As I think you will soon see, they have done a truly extraordinary job with this module, and I know they are eager to share this information with you today. Our hope is that after you have seen the demonstration for this module, that you might consider using this in your own classroom, research lab, or other professional setting. This training module was made possible through an award from the National Science Foundation, Division of Civil, Mechanical, and Manufacturing Innovation, Program on Humans, Disasters, and the Built Environment, with supplemental support from the Centers for Disease Control and Prevention. Candace, Rachel, and I especially want to thank Amy Wolken and her colleague Tracy Thomas at the CDC. Amy and Tracy have served as full partners in every aspect of this effort, and they have worked with us for months to ensure that the content is empirically rigorous and relevant to a wide audience. Amy is going to share a few words now regarding why the CDC supported the development of this module and how we hope it may be used. Amy?
Hello, everyone. As Lori said, my name is Amy Wolken, and I'm so pleased to welcome you to this webinar. Lori asked that I take a minute or two to introduce you to what we do within my unit at the CDC, while also sharing a few words about why we were interested in supporting the development of this particular training module. Our mission within the Center for Preparedness and Response is to help keep the U.S. prepared and ready to respond to a range of public health threats. As a senior advisor for at-risk populations, I come to this work with a lens focused on social equity, access and functional needs, and inclusion. We know to have a prepared nation means working with and alongside an increasingly diverse public. That is one of the reasons that we were interested in helping to accelerate the development of this module, which focuses on potentially vulnerable populations in disaster. Decades of research has shown that certain groups in our society have a harder time preparing for, responding to, and recovering from disasters. This module helps to summarize that research while also offering practical recommendations for advancing research and practice in this space. This module also ends by highlighting 10 big areas where we need more research as well as greater application of what is already available. We are grateful for your interest in this module, and our sincere hope is that it will be used by students, researchers, practitioners, and policymakers to help advance vulnerability reduction, preparedness, and response capabilities. With that, I'm going to turn the slides over to Candace Evans, who, as Lori mentioned, is a graduate research assistant at the center. She worked extensively on this project, and so I hope you will join me in offering her a virtual welcome.
Thank you so much for the introduction. As Amy mentioned, my name is Candace Evans, and I am a graduate research assistant here at the Natural Hazards Center and as part of the CONVERGE initiative. Over the past 9 months, I have been working on reviewing the literature and developing a number of the case studies that appear in this module. Today, I'm going to start by providing an overview of the Social Vulnerability and Disasters Training Module. Before I begin, I want to acknowledge that this is a lot of text you are seeing here. So first, I want to take a moment to orient you. What you can see right now is that the Social Vulnerability and Disasters Training Module is organized into 4 lessons: background, methodological approaches, knowledge to action, and future directions. Within each of these lessons are different topics, which present interactive information that aims to achieve a specific set of learning objectives. By the end of this module, participants should be able to define social vulnerability, understand the conditions and drivers that influence social vulnerability to hazards and disasters in the United States, identify potentially vulnerable groups and recognize the physical, psychological, and social factors that may amplify their vulnerability to hazards and disasters, explain the primary methodological approaches to studying social vulnerability, underscore the importance of the ethical conduct of research, recognize how studying potentially vulnerable populations improves hazards and disasters practice and policy, understand how research on vulnerable populations can positively improve outcomes for individuals and can enhance community resilience, recognize future directions for social vulnerability research, and learn about additional resources that support hazards and disasters research on vulnerable populations. You can see now that on the right-hand side of the page, there's a tracking bar where you can track your progress as you move through the module lessons and topics. Once you have completed a topic, you can always go back and review at a later time. Within each of the topic pages, information is presented through written text and a number of case studies, which are designed to provide context and present the information through real-life examples. For instance, within the vulnerable populations topic, we highlight certain groups that have been identified throughout the literature as being particularly vulnerable to hazards and disasters, such as children, older adults, pregnant, postpartum, and lactating women, persons with limited English language proficiency, low socioeconomic status populations, racial and ethnic minorities, and people with disabilities and chronic medical issues. In addition to the module's written and interactive visual content, we have compiled a list of additional resources relevant to conducting social vulnerability research. Within the Resources tab at the top right-hand corner of the screen, we provide links to existing measures, read resources, secondary datasets, and key readings that you can access. These resources can help you learn more about social vulnerability and support research activities that focus on populations vulnerable to hazards and disasters. At the end of the module, you can take a 10-question quiz to assess what you have learned. If you get at least 8 out of 10 questions correct, you will receive a certificate of completion with your name and the date. You can save the certificate as a PDF and can also access it at a later time via your training module login information. These certificates are intended to become part of a larger credentialing system to train the next generation of hazards and disasters researchers. The module can be used as a class assignment or other competency requirement to ensure that researchers have sufficient knowledge and skills to conduct research that is coordinated, comprehensive, coherent, ethically grounded, methodologically sound, and scientifically rigorous. I am now going to introduce Rachel Adams, a postdoctoral research associate at the Natural Hazards Center and the CONVERGE project. She is going to share her screen and conduct a demonstration of the Social Vulnerability and Disasters CONVERGE Training Module. While Rachel is getting her screen ready, let me remind everyone that you can register for the module at converge-training.colorado.edu/register. Rachel, over to you.
Hi, everyone, and thank you for that introduction. As Candace said, I'm now going to walk you through a demonstration of one portion of the Social Vulnerability and Disasters Training Module. For the sake of time, I'm going to guide you through the methodological approaches to studying social vulnerability lesson. This lesson presents common methodological approaches employed by researchers to study vulnerable populations in a disaster context. The first topic in this lesson is qualitative approaches. Here the module presents common qualitative approaches used to study social vulnerability. Examples from past research that have employed these qualitative methods are presented. For instance, in his book, Recovering Inequality, Hurricane Katrina, the San Francisco earthquake of 1906, and the Aftermath of Disaster, Kroll-Smith uses historical comparative analysis of documents covering the two events to explore the similarities and differences in two cities' recoveries from disaster. By tracing the historical trajectories of recovery in San Francisco and New Orleans, this work highlights the ways in which the disaster recovery process can inadvertently perpetuate existing social inequalities. After you finish reading through the topic, you can press Next Topic to move on to the next page. In this next topic, quantitative approaches, other case studies are presented to highlight common quantitative methods used to study social vulnerability. For example, the Gulf Long-Term Follow-Up Study is a longitudinal examination of the long-term health impacts of the Deepwater Horizon oil spill. The study collected telephone survey data from adult participants exposed to the oil cleanup. A subset of participants additionally received questionnaires on physical and mental health, clinical exams, and collections of biological and environmental samples. Data were collected over multiple years, and some preliminary findings suggest that proximity to the spill and duration of cleanup work are associated with heart disease, and that workers involved in handling oily plants and wildlife or dead animal recovery may possess lower lung function. One thing to note here is that when you hover over the citation numbers throughout the text, the reference pops up. You can also toggle the citations at the end of each page. The next topic is mixed methods approaches. The example presented here is a study conducted by Barnshaw and Trainer that uses interviews and surveys to explore a deeper understanding of stratification and inequality among Hurricane Katrina evacuees. The next topic is secondary data approaches. This topic presents past research using secondary data sources and indexes to study social vulnerability, such as the CDC's Social Vulnerability Index, the University of South Carolina's Social Vulnerability Index, and FEMA's HAZIS. The last topic of this lesson is ethical considerations for vulnerable populations research. Here, specific challenges with and ethical considerations for working with vulnerable populations in a disaster context are discussed. It is worth noting that at this moment, we have additional we have additional modules currently in progress. One of the modules on IRBs for disaster research, one on ethical challenges in disaster research, and one on conducting emotionally challenging research that will augment this section on ethical considerations. At the end of each lesson, there's a brief knowledge check, which is a 2-question quiz to make sure you are engaged and paying attention. The knowledge check does not count towards the final quiz. For those joining via your screen, you can see 2 multiple choice questions. The first question asks, in the book, Heads Above Water, Gender, Class, and Family in the Grand Forks Flood, Fothergill uses what method to conduct her research? There are 4 response options: surveys, focus groups, secondary data analysis, and ethnography. I'm going to press the ethnography response. The second question asks, which of the following is a quantitative method used to study social vulnerability? The response options are surveys, interviews, focus groups, and participant observation. I am going to press surveys. To submit responses, I press Finish Assessment. I now have the option to view questions and check whether I got the questions correct. As you can see, both questions are correct. I wanted to point out one more thing during this demonstration. As Candace discussed earlier, the module has a Resources tab where additional resources are listed that can support research on social vulnerability and disasters. These resources include social vulnerability measures, other web resources, secondary data sets, and key readings. The key readings consist of highly cited journal articles on different vulnerable groups in disaster, as well as notable review articles. Each of these resources is also hyperlinked. For example, if I press the CDC's Social Vulnerability Index, it will bring me to the resources website so I can access this data set. So that concludes our demonstration today. We are now going to return to the webinar slides.
Thank you so much, Rachel. We hope that this webinar has been helpful to you today. We also want to let you know that the next 3 modules we will be releasing over the coming months will focus on disaster mental health, which was also made possible with the supplemental support from the CDC, cultural competence in hazards and disasters research, and conducting emotionally challenging research, all made possible with the support of the NSF. We will be hosting brief demo webinars like this one for each of these modules and the others that are a part of this series as they become available. We also are planning one soon with our partners at the University of Washington Rapid Facility, so please stay tuned. A few reminders before I turn this back over to Lori to close out the session. To contact us about any questions you may have, please email us at converge@colorado.edu. To register for and access the CONVERGE training modules, please visit converge.colorado.edu/training-modules. This webinar has been recorded and will be posted on the CONVERGE website, converge.colorado.edu/communications. Lori, over to you.
Thank you so much, Candace and Rachel, for that demonstration and for all of your dedicated work. This module would not have come to life without both of you and without the support of the Centers for Disease Control and Prevention and the National Science Foundation. We also, again, want to thank Amy Wolkin for joining us today. We also want to acknowledge the entire team here at the Natural Hazard Center. Everyone here has contributed to this module in some way, either through reviewing, testing, or otherwise supporting this effort. Our team here also wants to give a call out to the nearly 30 National Science Foundation supported research experience for undergraduate students who tested this module this summer. These students were located at natural hazards engineering research infrastructure facilities across the nation, and they took time to take this module and to provide us with detailed feedback. We are and remain so grateful to those students as our first testers. Finally, we thank all of you for joining us today. We sincerely hope you will consider adopting this module for your classrooms or workplaces, and that you will share this with your colleagues, students, and others who you think may be interested in this topic. Thank you again for your support, and please contact us at converge@colorado.edu if you have questions, comments, or suggestions for how we can best share this module with others or how we can further improve it. Also, please visit converge.colorado.edu/sign-up to receive future alerts regarding training modules and many of the other resources that we are developing through the CONVERGE initiative. Thank you again, everyone, for sticking with us today, and please have a great day. Please take care of yourself and others.